Hello everyone and welcome back to surgery. Today we're going to be doing some cosmetic surgery, and I thought the two most common cosmetic surgeries that people get are boob jobs and nose jobs. So that's what we're going to do today.
Welcome to Surgery Squad's virtual breast enhancement surgery with silicone gel implants.
Woo!
I'm Dr. Susie, and I'll be assisting you with this procedure today.
Good,
For
I
those
guess.
with a weak stomach or have children in the room, I need to let you know that the next few steps get a bit graphic and contain nudity.
You didn't tell me this when I gave birth to a baby.
For work or
Seriously?
Click the continue button when ready.
I'm not ready. I will never be ready, Dr. Susie, okay? Like, I watched a vagina open up and squeeze a baby out, and now you're telling me to watch out for explicit content. Okay, well, let's continue. Let's look at some boobs, and let's make some boobs bigger.
Our patient has recently lost weight.
Oh my God!
Her surgeon offered a computer program that simulates what the patient would look like with different breast sizes.
I've seen this on TV before.
Use the slider to
on TV
demonstrate to our patient what she would look like with different size breasts.
No! No, are you giving me the opportunity to change her breast size with a little computer program right now so I can make them as big as I want? Well, not really,
looks
but
like our patient has chosen a size she likes.
So the biggest one. All right.
Let's put on our gloves and see what we can do. We must first mark the current top of the breast and where the midline between the two breasts is as well.
Okay.
This will help us when we position the implant. I've marked each of these with a dotted line. Can you draw them in with a marker?
What did you use to draw the dotted line if you didn't use a marker? You're just making me waste time here. This is kind of cool, guys. I've actually kind of wondered how exactly breast augmentation is done. I know sometimes they do like a nipple one and sometimes they go underneath the boob. Yeah, okay, well, let's just go ahead and mark there. And I'm just gonna draw a little happy face on this boob here. What's the point of doing that, Matt? The people can't even see it. Well, I'll draw a happy face right in the middle then. How about that? There you go. Oh, man. Look at that happy face. Okay. All right, good. Now we just gotta draw a few more of those in, and we should be good to go. It really does not matter. You can continue anytime. Okay, go.
We need to measure the breast to decide where the top of the implant should go.
My happy face went away.
We do this by measuring with the caliper from the middle of the areola.
All right.
Draw with the marker at 12 centimeters to mark the top of the implant, and then draw the outline of where the implants are going to be placed.
This is a lot of work, guys. Like a ton of work. Okay. Oh, shit.
Now that we've marked the patient,
never mind.
Let's get her to the operating room.
I didn't have to do it.
Next, we'll use a chemical antiseptic known as chlorhexidine to cleanse the patient's skin. Use the applicator to apply the chlorhexidine to the surgical site.
Chlorhexidine. What a great word, guys. Chlorhexidine. I'm going to name my first child after it. All right. Well, there you go. I'm just rubbing some chlorhexidine over your breasts. No big deal. I don't know why I'm talking to you because I'm pretty sure you're asleep because I just gave you an IV and stuff. So I'm assuming we put you under. If not, I hope you enjoy the sensations. You're welcome.
While some anesthesiologists may prefer to give a patient a general anesthetic using the IV line, we'll be administering it using a face mask.
So she was still awake.
Start by placing the mask over the patient's nose and mouth. Once it's in place, we'll turn on the anesthetic gas.
And I swear she did not say anesthetic that time. I don't know what it was a mix between anesthetic and antiseptic. You don't want to mix those two up, okay? You guys want to hear a story? Because I'd totally be down for telling you a story. I've had several surgeries because I have ear problems. I had a hole in my eardrum and had to get it patched up and stuff. I'm pretty sure I still have a hole in my eardrum. But I remember being put under with the gas, and it's really freaking cool. They put on the mask. When they gave it to me, they let me choose what I wanted, and I chose strawberry. But when they put the mask on, it was bubblegum. So I was kind of angry, but what can you do? You know, people are putting you to sleep. You don't really have time to fight back. But they put the mask on me. I start breathing in, and then everything just starts going all numb. So my whole body feels all numb. Everything starts getting all blurry. The beeping going on the monitor starts getting echoey, like and then everything just gets all overwhelming. And then all of a sudden it just starts getting smaller and it starts spinning around and just disappeared. It was so cool, man. It was a lot of fun. It actually made the experience of getting surgery a lot better. Okay, so let's just do that to her now. There you go.
Now that our patient is unconscious, we'll insert an endotracheal tube into her mouth and down into the windpipe. This will help her breathe and provide a constant mixture of oxygen and anesthetic gases during surgery.
Those are the worst, man. They stick tubes down your throat. Nobody wants a tube down their throat. That's what makes like it's shitty when you're done with surgery, because your throat's all messed up because someone stuck a tube down there. But okay, whatever you gotta do.
The incisions for breast enhancement surgery may be made under the breasts, around the areolas, or under the arm. For this procedure, we'll make the incision under the crease of each breast. This area leaves little noticeable scarring. Now sketch where we'll be making our incisions.
So now I'm wondering, what do you do if, what would be the reason that you'd do a nipple one? I'm not really sure. Or like an underarm one. That's not so bad. But I feel like you should probably leave the nipples alone if you can. I guess if you go so big, you just gotta kind of mess with the boobs altogether. You gotta do a lot of crazy stuff. Here you go.
We're
gonna do
use
it.
the scalpel and make the necessary incisions so we can insert the implants. Our patient has chosen silicone gel-filled implants because they have a more natural feel. We'll have to make a slightly longer incision in order to insert the implants. This is due to the implants being full when inserted, as opposed to saline implants, which can be inserted empty.
So it's like some parts of each are good. Like if you get the saline ones, they stick it in and then they fill it up, I think. But if you do silicone, you got to put it in all at once. So you got a bigger scar, but more natural feeling breasts. Ooh. All right, there's one. And there is number 2. We're getting there.
With our incisions made, we'll now make room for the implant. To do so, we need to slide a finger into the incision and gently sweep it back and forth to separate the pectoral muscle from the ribs. Using a finger is gentler than a metal instrument and lessens the chance for damage to the nipple's nerves. Can you slide your finger into the incision and move it back and forth to create the pocket for the implant?
Can I? Absolutely. Get those fingers in that boob. Oh, damn. Well, that is fun. That looked really freaking weird. Now I gotta do the other one as well. Don't worry, I'm on it. Dr. Matt's on the case. Oh, baby. That frame rate.
Now we carefully insert a retractor and cauterize any muscle groups still attached.
Okay, so we gotta put something else? What the hell is that? Kinda looks like a puffer. Alright, well, in you go. I don't like this.
Breast enlargement is achieved through the placement of a silicone pouch called a lumen. The lumen may be filled with either silicone gel or saline. There are advantages and disadvantages to each type.
That's what I said.
Click each implant type to see the pros and cons of each.
Fine, I'll do it. What about silicone? Pros: firm shape, resistance of rippling or collapsing, similarity in feel to natural breast tissue. But the cons are potential silent ruptures. That doesn't sound very good at all. Silicone-related health risks and can inhibit mammograms and breast exams. Okay, well, what about this saline one? What's up with that? Low safety hazards with leaks. Okay. Immediate detectability of a ruptured saline implant. Lower costs increasing or decreasing the size of existing saline breast implants is fairly simple and creates less noticeable scarring since it requires smaller incisions. Cons: less natural feeling, weight, and texture tend to collapse or distort when laid flat or in other positions. Okay. All right. Let's go.
All we need to do is open the sterile pack and insert the implants into our patient.
Dr. Jeff's silicone
With our incisions
implant.
made, we now need to slip the implants into the pockets we created under the chest muscle.
Looks like pudding
We
or
do
something.
this with our hands.
Or like Jell-O.
Because the
Snack
lumen
pack.
is fully filled, it can be a little tricky to get the implant in place. As you tuck in one side, another will slide out. Can you use your finger to slide the implant into place?
Yes, I can, Dr. Susie. Let's do it. Here we go. Whoa! It's in. That was easy.
Now we adjust the implant with our finger.
Okay. Just wiggle it around. Wiggle, wiggle, wiggle.
Great. Let's do the other breast, and then we'll check them for evenness.
Okay. So here goes breast number 2. In it goes. Great sounds.
Our patient is still under anesthesia, but we've placed her in an upright seated position. This is so we can inspect the breasts for implant placement and evenness.
Smart.
We examine the top and bottom of the implants in the breast as well as the placement of the nipples. It looks like the left implant is a little higher than the right.
Oh
Can you
no!
lower it?
Well, you kind of got me in a weird position right now, so how can you really tell? You gotta face it, like, forward so I can see, but okay, if you say that I need to change the implant, let me just get on that there. There you go. Wiggle that around.
Perfect. Now we need to move our patient back to a flat position to prepare to close the incisions.
So how do you hold it in
With
place?
our patient lying down again, we'll inject some long-lasting numbing medicine into the incisions before closing. And we're ready to close.
Click where indicated to suture the wound. Okay, I think this is pretty much it now. You just you know, get that all straightened away, and we can send her home with bigger boobs.
And there we have breast enhancement surgery
Whoa!
using silicone implants.
Look at
After
that
our
boob
patient's
difference.
recovery, she is happier about her appearance and is more confident in herself. Thanks for stopping by Surgery Squad.
You got it.
Why not check out one of our other great surgeries?
Not those ones, okay? We gotta do a nose job. It's time for a rhinoplasty. It has nothing to do with plastic rhinos, guys. Unfortunately.
Welcome to Surgery Squad's virtual closed rhinoplasty surgery.
You don't even sound the
I'm
same.
Dr. Susie. Today we will be performing rhinoplasty.
Where's Dr.
It's
Jeff?
commonly referred to as a nose job.
I was okay with the first one not being
In
him.
this cosmetic surgery, our patient is a young lady who's looking to change the shape of her nose. We'll perform a closed rhinoplasty procedure to reshape her nose into something she finds more appealing.
Cool.
Some surgeons will perform this surgery using a local anesthetic and sedation, which makes the patient numb and in a dreamlike state. I prefer to work with a patient under general anesthesia and completely asleep.
Okay.
What we're doing today is reshaping the bridge of the nose. Our patient feels it's too wide and doesn't like the hump on it. The thinning of the nose is called an infracture. I'll bet you can't guess what the widening of the nose is called.
X-fracture.
All right, I'll tell you. It's an outfracture.
Fuck.
Some
Should've
patients
got
may
that.
also want the tip of the nose reshaped. That's called typoplasty.
Typoplasty.
But as I was saying, this patient only wants an infracture and some reshaping. Easily done.
Easily done.
To begin this procedure, we need to open the nostrils as wide as possible. We do this with a retractor. Can you place the retractor in the patient's right nostril?
Look, Dr. Susie, I don't like the way you talk to me. I mean, I let it slide in the first surgery, but since you're here again, can I just let you know that this is not fucking Dora the Explorer, okay? Can you find the map? Good! You found the map! Okay, well, I'm gonna put some retractors in her freaking nostril now. There you go.
Now
Whoa!
with the nostril opened wide,
Damn!
we'll make an incision inside in a crescent moon shape.
Crescent moon.
That will allow us to access the bones and cartilage that make up the nose structure.
I wanted to do that.
I've made the incision. Can you use the forceps to remove that portion of the nostril?
I guess so, since you did.
Surgeons
Shut up!
must be hyper vigilant when doing this portion of the procedure, as it can damage breathing and sense of smell.
Did you just do it on your own? Like, I was about to do it, and now it just disappeared. But okay. Tweezers. What am I Oh, there it is.
To reshape the nose, we're going to chip off the dorsal hump with a chisel tool called the osteotome.
Cool.
We place the osteotome at the base of the hump and then carefully tap on it with a small rubber mallet. This has to be done very gently and takes a careful touch. I'll position the osteotome and you tap the end with the hammer.
I would not want to be this lady getting a nose job and this random person, this random Canadian YouTuber has the help with the surgery. But okay, well, let's just give that a tap. Oh, are we chipping a giant piece off here? Wow, it looks like we are. Damn.
Now that the hump is loosened, we need to pull the bone and cartilage out of the nose. Use the tweezer-like forceps to slip it out of the incision.
Guys, honestly, this would be scary. Like, this is why I don't have a tattoo. The same reason that well, no, I don't want a nose job. I kind of like my nose. But the point is, this is scary. Because once you do it, you can't get your nose back. I mean, look at Michael Jackson. That guy's nose was absolutely messed up. He just kept making it smaller and smaller. And then they were just like, sorry, Michael, but we can't give you your nose back. Once we take the bone out, it's gone, okay? But okay, here you go. It's gone.
Now that the bump is out of there, we need to smooth the edges on both sides with a rasp.
Rasp. All right.
The space left by the bone we've removed is referred to as an open roof. To close the open roof, carefully tap the osteotome along the path that I've marked. This breaks the nasal bones so we can reposition them.
Interesting.
Tap the osteotome once each time I reposition it on the left and right nostrils.
I'm learning a lot today, guys. These were actually like the two most informative surgeries. Like, I am really digging this, okay? Look at that. We're breaking the bone. We're knocking it in so that we can close the roof or something.
Now that the bones are broken, I just take my fingers and reposition them to close the open roof.
Eh.
Because we made such perfect breaks, the bones slip right into place and the nose is perfect.
Damn, girl.
A few stitches to close up the incisions.
You didn't even let me do the
and then we
stitches?
place nasal airway splints in each nostril to hold things in place. Steri-strips go across the nose, and an external nasal splint is added to hold everything tight.
Okay.
Our patient will have some bruising and minor pain for a few days. We'll remove the splints in about a week. Most of the swelling will be gone by then, but there can be a bit left for a few months. And there we have it. Thanks for coming by. Catch more of my great surgeries here at surgerysquad.com.
Okay, Dr. Susie, let me just tell you something right now. This was absolute garbage. I didn't get to cut anything. I didn't get to do the stitches. And I didn't even get to see a before and after of the person. Like, she wanted, like, a certain thing done with her nose. She wanted to get rid of the little bump on her nose. Okay, cool. Well, can I at least see what it looks like? I mean, you showed me the boobs. You were like, oh, it's super important that you see that the boobs got bigger. I freaking know the boobs got bigger, okay? It's a boob job. We put implants in there. But I wanted to see what the nose looked like, and I didn't get to do it. And now I'm just kind of bitter about it, guys. So I think I'm just going to calm down, okay? Calm down. It's okay. It's just an online surgery game, Matt. It's not going to change your life. All right. So anyway, guys, I'm going to end this video here. So thank you so much for watching. If you enjoyed this video, don't forget to leave a like, and I will see you next time. Goodbye.